you guys can work together and then take Sando to the next level. And those who are already a part of Sando family, you guys are doing a good job. Continue the good work, keep up the good work, continue with your hard work, and then we can work together. You can teach something to those who have recently joined. So the whole purpose of starting this sessions, one of the many sessions that we'll be having in the next few days, was to, it will be all those who have already part of this Sando, they are aware of what the Sando lab as a genetic lab is. You know everything about Sando. So it will be like a revision for you guys. And for those who have joined, mainly the purpose of having this session was to make you aware that what Sando as a lab is, what are the facilities or tests that we provide. I request all of you to mute yourself to avoid any disturbance. Kindly mute yourself. Yeah. So basically, to those who have recently joined our Sando family or Sando team, these sessions are for you so that you can be aware of what Sando lab as a genetic lab is, what all tests do we provide, who are our target audience. So this session is mainly as an introductory session to give you a brief overview about what all sessions we are going to have in the next few days, who all will be taking what all sessions, what all tests that we conduct here. So as you can see, for my session, I'll be talking basically about genetic testing and counseling. So like any other diagnostic labs, even we, provide tests for, genetic testing, genetic related conditions, like any other diagnostics where they do renal function tests or liver function tests or any other tests. We as a genetic lab provide facilities for provide tests for genetic conditions. So I'm pretty sure that before you guys joined, you must have read about what genetic condition is, what genetic tests are. I'll just give you a brief overview about this. So basically, as the name suggests, genetic tests is mainly advised or prescribed or suggested to those patients who have genetic conditions, not any other conditions, or not any patients who have any medical conditions, mainly those patients who have genetic condition. So obviously the question arises, what's the difference between the genetic test and any other test like renal function test or liver function test or any other test? What's the difference, and what test to prescribe and to whom to prescribe and who is authorized to prescribe this test? So basically, before we proceed, I'd like to show you this, as you can see it on your screen, that why and how genetic testing is important. If it is important, then in what way genetic testing is important? First, obviously, as you can see it here on your screen, genetic testing is done to those who have a genetic condition or who are suspected of having a genetic condition. Obviously, and the testing, the purpose of this test is mainly to diagnose any clinical suspicion or to confirm any clinical suspicion and to know that what is the etiology. If you're suspecting a person with a genetic condition, through this test, you would be able to know that what genes are involved, what are the factors which has led to this condition. Second, as I had mentioned, pinpoint genetic factors that caused your disease, because obviously if you're suspecting something, you need to confirm it by prescribing a right test, a right genetic test to the person, if you know that what the condition is, and then it will help you in knowing what the condition is, what genes are involved. And if the person has a family history of a genetic condition, a person comes to you and then he is not affected right now, but he or she has a family history of someone in the family with a genetic condition, then obviously he or she might be at risk, and then they might come to the doctor or to us asking that what genetic test should be done, whether I will get it in the future or not. So in that situation, by doing this genetic test, you can predict whether the person will get it or not, or the person is already affected, then how severe it will become in the future, whether it will progress or not. In other situations, like if the person is already on the medication, then whether the medication, the dosage is right or not. if the dosage is being given, whether we need to lower the dosage or we need to continue with the dosage, or do we need to increase the dosage, then what should be the test for that? Or if to know what the genetic factors are, whether if you have that genetic factor, if we come across this genetic factor through genetic test, then what is your risk of getting it, or what is the risk of you passing it down to your next generation, to your children. So these are all the factors, based on which the testing is done or the testing is advised, and then it helps in all these aspects. So obviously, when the patient has any issues, they'll go to the doctor. The doctor will suspect the patient with genetic condition or diagnose genetic condition. But then again, he or she wants to know what genetic factors are and in what way genetic testing can help. So these are the things which, when you do a genetic test, these are the aspects which can be covered and which will help in, what are things that you want to know about the patient. This genetic test will help you know that. Now the question is, uh, how these tests are prescribed, who will prescribe this test to the patients, how would we know whether the prescribed test is right, for what all conditions do we have to test, which genetic test, whether one genetic test will solve everything, whether it will give information, or do we need to go for further testing. So how a patient would know this? Obviously a doctor would know it. Persons or people or technicians or team who is working in the lab knows it, but all this information is only confined to us. How a patient would know that if the doctor has prescribed us a genetic test, what genetic test is that, and why we are prescribed this test, why the doctor has prescribed us this test, and what is the use of this test. So that's where the genetic counselors will come into picture. So as I had mentioned that I am a genetic counselor. So what genetic counselors do is that they communicate all this information to the patients. So as a sales team or as a salesperson, when you go to the doctor and when doctor says that this is the person, we have collected the sample, we have prescribed this test to this patient because we are suspecting this person with this condition. Now you have been given this information by the doctor. Obviously, doctor or clinician knows what genetic condition is, what he or she needs to prescribe, which they have already done. But the patient is someone who is giving his or her sample, and he is or she is not aware that what is going on, what test it is, how much do I need to pay, what should be, what if the report comes out positive, what should I do, if the report comes out negative, should I stop it here, or should I go for further testing, regarding this information, whom should I approach? So that's where genetic counselors will come. So this is one of the facilities that our Stando lab provides along with the genetic tests. So what all genetic tests do we provide, that I'll show you in the next subsequent slides. But when a doctor prescribes a test to a patient, so there's kind of a gap between a doctor and a patient, or a patient and a lab. So we as a genetic counselors bridge this gap, so that whatever doctor is trying to convey through tests to the patient, we put it in a simple words, in a layman words, so that we can explain to the patient that, okay, this is the test the doctor has prescribed to you, and this is the reason and the purpose of giving this test or prescribing this test or genetic test is so that we can know what genetic factors are. And based on this conversation, if patients have any queries, we can answer their queries, that why did I get this genetic condition, and how come it's been running in the family, or nobody else in the family has it, then how did I get it, what is the cause behind it. If I get married, or if I have a child, or if I plan for a child, will I be passing it down to my next generation, or if I have this condition, what is the treatment, will this genetic test help in the treatment or management, or for better management. So these are the informations which obviously a doctor has a very stipulated, a very limited time. I mean, they cannot give all this information to the patient, right? They just tell that this is the thing, we are prescribing you the test and you need to give the sample, and then they'll direct the patient to sales team, and they'll do the collection, take the clinical details and everything. But what about all this information? This is something which sales team cannot provide. This is something which doctors don't have the time to provide, and this is where we come into the picture. So we give family with complete and accurate information about this genetic disorder. Whatever information or queries that they have, we try to clarify regarding treatment, management, what will be the prognosis, and what will be the next best alternative. So this is before testing, we talk to the patient, and then when the patient is satisfied, that's when they give the sample, and then they wait for their reports to come, right? So coming to indications for genetic counseling and genetic testing, when a doctor prescribe a patient or advise a patient about the genetic test, obviously the main purpose or the main criteria is the patient needs to have a genetic condition or symptoms related to that. Not any other patient. The patient comes to a doctor saying that I have an injury, I fell down, broke my leg. This is not a criteria to go for genetic testing or counseling, right? So if the doctor thinks, okay, the patient needs to be prescribed a genetic test because he or she, I'm suspecting, that has a genetic condition, they'll prescribe. And that's when also the patient will be directed to us, genetic counselors, for a genetic counseling session. So what are the criteria? What are the indications? This is something which doctors are aware. We are aware as a genetic counselors. But even as a sales team, you should be aware that if the doctor is prescribing a genetic test to the patient, what are the criteria? It could be hereditary disease in a patient or family, where this is something which everybody is aware of, knows that this is something which has been running in the generation. We don't know what the cause is, we don't know what the condition is, but there's something which is running in the family from the father's side, from the mother's side. Or if the child is born with a birth defect or malformation, that what we say, like there's something wrong with the jaw, with the head, there's deformity in the bones, and this is something which a neonatologist or a gynecologist or a pediatrician, doctor, a child specialist will observe, and they'll immediately will come to the conclusion, okay, this child has some issues. So even though there is no family history but looks like genetic, I think we should prescribe genetic test. This is the genetic test. Or if there's a person in the family with intellectual disability or mental retardation, or a mother, I mean, a first time mother, a lady who has become pregnant, but after the age of 34 or 35, advanced maternal age. So, is she at risk of having a child with any genetic issues? Or a couple who had a history of miscarriages, abortions, recurrent miscarriages. They've been trying to have a child. They've been planning for family, but either unable to conceive due to some infertility related issues, or maybe they do conceive, but before the child is born, the child dies in uterus, or any other exposure to chemicals, any history of you know any other conditions, or like as you have seen in the south, there is a lot of families that come to the doctors or that come to us for counseling. They have a history of getting married in relation. They get married to their close relatives or distant relatives. We call it as a consanguineous marriage. So these are some of the situations or conditions where if the patient is prescribed for genetic test, obviously they also need to go for genetic counseling. So when as a salesperson or as a sales team, when you go or approach a doctor or a new doctor, and when you crack a new counter and you tell them that these are the tests that our genetic lab, Sandor as a genetic lab, provides, you can also tell them that genetic counseling is free. Because obviously when the sample of a patient is being sent to our lab for processing, then obviously they also should undergo genetic testing, pre-test, post-test, what all information that the patient needs. So this is something which you can convey to the doctors, that we do all this tests, and for all the genetic tests, if with your permission, if you would like, we also have genetic counselors who would like to talk to your patients about the genetic test that you're prescribed, take their family history, so that the clinical part which is taken care by the doctors, and the genetic part which we take care as a genetic counselors, family history and everything we take, all this information we club, and then we give it to the lab people, who based on this information can do analysis. And when the report comes, it becomes easy for them as well to do the correlation. Because without all these clinical details, without the genetic information, family history, it's not like we cannot conduct all these tests. We can, but then it makes our job much easier actually with this all this information. So uh, I would request you all that whenever you take sample from the patients, make sure that doctor has given all the clinical details, relevant details, what the doctor is suspecting, what is the clinical diagnosis. And if possible, you can talk to the patients as well, if you can take their information as well. Or if the patient has been referred to us for counseling, then we can do this. We can collect all the relevant details, and we can share the same with the lab people. So, and that's why I've mentioned here, just a second, a proper record of the family history of the patient is necessary, be it of the past, any medical history, any other tests that they have undergone in other labs. Those reports are also important because we club all this information and then we give it to the lab so that they can do analysis without any hindrance, without any problem, and they can release the report within the stipulated time. Okay. So if there is any other family member, distant family member in the person whose sample you have taken, even that should be considered. This is something which we take care of. But in case if the patient doesn't agree or if the doctor doesn't send the patient for counseling, maybe you are the first ones. You are the people who will be talking to the patients face to face. So if you can take as much information about the person and about his or her family members, that will be good. And if they are referred to us, then not an issue. We can take care of all this information. So this is our general workflow, which I have told you, that if the patient has any issues, they'll first, obviously, they won't be approaching a lab or they won't be approaching genetic counselors. They'll be approaching the clinician, the doctors that you talk to on a daily basis. So if a pediatrician or any other doctor suspects that the patient has any issues, then they'll refer the patient, they'll prescribe the patient a genetic test, and then to give all this information about what the test is all about the person's family history, about person's own medical history, this pedigree, family information, when this disease started, what is the onset, all this information is taken before sending the sample to the lab or sending the sample to our lab for should they approach a clinician. And when the report is called post-test, when the report comes, we explain the report not only to the doctors, obviously not only to the patients, but also to the doctors. Distinct report, as you must have seen, report of Sando, any Sando report you can take, a dummy report, you can see that it's very detailed and very informative. But this is something which we as a lab people or as a genetic counselor or as a clinician can understand, but obviously a patient cannot understand, right? So who will give all this information to the patient? Because obviously, again, as I told you, doctors don't have time to give all this information, right? They'll say, okay, what I had suspected, test report has confirmed that, and maybe you can start with the medication or something. But what about what the report shows? Whether it is positive, whether it is negative. If it is negative, then what should be the next test? Further testing, what should be the next test? If it is positive, that do we need to stop there? Or if anybody else in the family is at risk, should we test them also? Even they should be tested. Or if the person is a father, then or if the person is a mother, are they at risk of passing down to the next generation? What is the risk? So all this information comes in post-test counseling based on all the information that we get through tests. We try to provide all this information in simple layman terms to the patients. And this is how it works. And then this information is not only given orally, but also given in the counseling note, in the written format, which is shared not only with the patient, but also with the patient's respective clinician. So this is the general workflow. Other than this, as a genetic counselors, as a genetic lab, this is another facility that we provide, and this is something which clinicians can avail, that in case if the report comes and doctors are not sure what the report is all about, we can have a clinical review, we can have a discussion with the doctors, ask them that if the report has come, this is the genes that we have found. So what is your opinion? Do we need to do any further analysis? Is it matching with your patient's condition? Because we work in a lab, so we have not seen the patient. We don't know what the patient's symptoms are. Whatever symptoms, whatever information that we have is something which is already shared by the doctors, and doctor is the one who has seen the patient very closely. So clinical review is another facility that as a genetic lab, Sando provides. So if doctor tells you that even though the lab has provided us the report, but what we're supposed to do with the reports, we don't know. So you can tell them that you can talk to one of our technical teams, the genetic counselors, you can talk to them, discuss about the reports. It will help you know what the report is, what we have mentioned in the report. Do we need to go for further testing? Extended family screening, do we need to do? What is the management part? Treatment part, obviously they'll deal. We are not authorized to give or prescribe any medication, but then again, what should be the treatment? What should be the management? Whether it is right for this condition, for the genetic condition that they've suspected, to proceed to that next step, a discussion with a clinical discussion or discussion of a doctor with the genetic team or lab members or genetic counselors, it becomes easy. So, easy for not only clinicians, but also for the patients, because obviously when the report has come, they'll keep on waiting that when the doctors will call, what does this report mean? And they'll become very anxious. So this is something, another facility that as a team member, as a lab member, or as a genetic counselors, we provide. And these are the other aspects of our lab. As a genetic counselors, we educate doctors. We now every now and then we conduct CMEs, continued medical educations, webinars, so that we can learn from them when it comes to clinical aspects. When it comes to genetic aspects, we can discuss with each other through CMEs, through webinars, and then with all this information, we can put it to some good use for the patients. Okay, so now we have discussed what are the indications for genetic testing as well as genetic counseling. But then the next question comes, how would we know when the patient is referred for genetic testing, or if the patient has been referred for the genetic counseling? Is this the only phase where the patient has been referred, or patient can be referred for counseling or testing? What are those phases? What are the different kinds of counseling? So these are some of the aspects of counseling as well as testing, even though I've mentioned only counseling. But when I write counseling, it also means that these are the stages where they can be sent for testing as well. Because obviously when the patient has been referred for testing, it is usually followed up by counseling as well. So what do you mean by premarital counseling? If marriage has been fixed and there is a family history on would-be groom's side or on the bride's side, and they're a bit worried that if we get married, whether I will or my wife or my husband will pass it down to their next generation. What is the probability of that? Then before marriage, they can undergo counseling, premarital counseling. It has nothing to do with marriage. It's just that premarital counseling, it means that if there's any genetic condition involved, or there's a genetic disease that has been running in the family, and they want to get married, but they're a bit concerned that whether I or my wife or my husband or both of us will pass it down to the next generation. So before marriage, we counsel them that, after the marriage, when you're supposed to come for testing, or during the pregnancy, when you're supposed to come for testing, what all medical records we need, or what all tests that you need to undergo, followed by genetic counseling. So this is what premarital counseling is. Preconception is something which is done after the marriage, right? If especially in our south, where most of the marriages that you'll see, they tend to get married in their relatives, consanguineous marriage, that's what's it. So even if there is no family history, if there's a family history, fine. But even sometimes in some of the cases where there's no family history, and you'll see multiple consanguineous marriages, a lot of members of the family getting married in relation, and some of them after the marriage, the newly married couple will come with a concern saying that we have heard from the doctors that you're married in relation. So there could be a possibility or probability of you passing down any genetic condition, or your child might get any genetic condition. It's better that before you plan a family, why don't you go for genetic test and see whether you guys are carrier or not? Even though both the couples, or both husband and wife, are fine, they are not affected with any genetic condition, but still, because they're married in relation, they are a bit concerned that whether they will pass down any genetic defect or any condition or disease to their child, and this is something which they don't want. So this is where preconception counseling comes. Means before planning for the child, we take their family history, pedigree, and then we suggest them for test, or doctor suggests them for test. The sample is sent to the lab. We give all them the information that why before planning for the child, the test is important, how this test will help you in knowing the risk, whether you are at risk of passing this condition to your next generation or not, whether if you plan for the first child, what is the risk of him or her of getting any malformations or any birth defects or anything. So this is where the preconception counseling comes into picture. Prenatal, I'm sure most of you are aware, prenatal is something which is counseling or testing which is done during the pregnancy, not before planning the pregnancy, not after the delivery, during the pregnancy. That there is no family history, there is no genetic condition, husband and wife or parents are perfectly fine, this is their first child. But during the pregnancy, when they visit gynecologist, during the scan, the gynecologist finds that, oh, the child has some issues. Any birth defect during the scan. Obviously, scanning is something which is done to all the women, irrespective of whether they have genetic issues or not. This is a routine screening thing which all the gynecologists do, and this is the main purpose, that during the screening, when they find anything abnormal during the scan, that's when they talk to the mother saying that this is what we are finding. I think you need to go for the test. Now, this is a very critical period, prenatal, because obviously is the child could be first child or a second child. First child was normal, but second child, this is issue that has come up. Or this is your first child, never they had issue related to conceiving and everything, and then suddenly they get a shock during the scan that the gynecologist is saying that there's some issue, and whether they need to continue, not continue, whether it's a false positive, false negative, we don't know. So who will give all this information? Who will do test during this pregnancy? So we, Sandor, as a genetic lab, we also take samples during prenatal stage. We take samples, be it blood from the mother, amnio, which is the liquid which surrounds the child in the pregnancy, in utero. So when the testing is advised, that should be followed up by a prenatal counseling, where we speak to the would-be parents that now this is your child. Now because in the scan or during the screening method or any other test that is done usually during the pregnancy stage, gynecologist found something unusual, something abnormal. We are not sure what it is, but through this test, we want to confirm that. And what is the purpose of this test? If it comes out positive, what should be done in the pregnancy? If it is negative, then should you report back to the doctor with the report? So testing as well as counseling, again, is something which is provided by our genetic lab. So if it is prenatal case, we follow it up with a prenatal counseling, or when the testing is done, again, with the report, we explain to the mother, because usually this is the stage where they usually get panic. They're very much anxious that what will happen to the child, what was the report, do we need to continue or not, do we need to go for another testing? So all this information is provided during the prenatal counseling to the mother or the parents. Postnatal, as you must have understood by now, prenatal means during the pregnancy, postnatal means after the delivery. As I had mentioned in one of my previous slide, postnatal is meant right after the child, everything was fine during the pregnancy, no scans showed no issues, everything was normal, and suddenly when you see a child, when the child is born, has some eye-related issues, some of the issues which was not detected by the scan during the pregnancy, and when the neonatologist or the person who deals with the newborns, he or she will see that there's something issue with the child. The child is very weak, the child is not drinking milk. What could be the issue? If based on the symptoms that he or she has collected, they'll collect the sample, they'll send it to biochemistry lab for some biochemistry analysis. And when the report comes within 1 or 2 days, they need to follow it up with another genetic testing. So there's a lot of things right after the birth. There's a lot of things that goes on with the parents, and then there's no time for any of the doctors. I mean, they're busy with the treatment, with the management. There's no time for them to discuss about what is going on, what the condition is, what we have seen in your child. Should they be discharged or what? So this is where parents will be counseled, postnatal counseling. So when their sample is sent for testing, and after the delivery for the child who's a newborn, we tell them that this is the reason the sample of your child was sent to our lab for this biochemical analysis, or for this chromosome analysis, or for any other genetic testing that our lab provides, and what is the purpose. So all in all, the concept of all these counseling is based on what stage the patient has come to you for testing or for counseling. Based on that, we have decided all this. Pediatric counseling, again, pediatrician, as you know, child specialist. So if a child has some issues, we do counseling, not to the child, obviously, because counseling is done to those who are of 18 or above 18 years of age. So if there's a child, then obviously we talk to his or her attenders or parents. And obviously adult counseling is something which is done to those patients who are above 18, 19 or 20 years of age or 30 years of age. Because obviously when we are talking about genetic testing or genetic conditions, it's not like it will happen only to the children. It will happen to anybody from anybody, any age. I mean, like the child who is of 1 day old, or to a person who is 30, 40 or 50 years old or 60 years or more than that. So those who are above 18 years of age, they can come for adult counseling. I mean, there are certain conditions which occur, or the symptoms of those conditions will manifest after 18, 20 or 30 years of age. And they'll be like, from the childhood, I was fine. There's no family history. Then how did I get it? Why did I get it? Now, what will happen to me? Why this test? Whether this test will help in the treatment or management, whether if the doctor is giving me any prescription or any medication with this positive report, will it help in changing the course of the management, or will it change the dosage of the medicine? So based on the condition, based on the available clinical information from the doctors, based on the family history, based on the genetic report, all these informations we club, and then we try to give this information. I know it's a lot for the patient, so it's not like we do only one session. We sometimes we do 1 or 2 sessions. So in each session, we try to clarify what all queries a patient has. We put it in a layman terms, simple words, so that before the patient leaves our lab, he or she should be satisfied that, okay, this is the reason doctor has referred us, and I think we are fine with this, and I think we should proceed for the next step. Otherwise, if you give them a plethora of tests and patient has no idea, and he or she keeps spending money, and they're like, we have spent thousands and thousands of rupees, and here no one is helping me out with what the test is all about, why I've been referred for this test, nobody is giving me any information about this test. So as a lab, as a kind of member, as a team member, what we do is we not only do a genome analysis, genetic testing, but along with that, what we are doing, why we are doing it, what is the purpose of it, all this information is also provided by us, not only to the patients, but also to the doctors with the help of clinical review, or for the patients with the help of pre-test or post-test counseling. Now, coming to the main slide, these are the tests, some of the tests, even though I have mentioned main things, as you can see, but doesn't mean that these are the only tests. We offer other tests as well, but these are the main tests that Sandor as a genetic lab provides. I won't get into detail of each and every test, because an expert or a senior or a manager from each of the departments will be talking about these tests in the next few days, and they'll be giving you all the information that what these tests are about, why these tests are done, who should be approached for this, what kind of patients are prescribed this test, which kind of doctors prescribe these tests, and you need to approach what all diagnostic centers or what all doctors you need to approach and inform them or make them aware of. As a Sandor, as a genetic lab, we provide all these tests. So all this information you need to get, and you will get in the next few days, as we'll be talking about all this. The purpose of this session was to give you a brief overview about what all tests we provide, like NBS7, hemoglobinopathies related to blood. We do enzyme analysis, organic acid disorders, amino acid disorders. These all come under, material markers. They all come under biochemical genetics. Karyotyping fish, which is again comes under cytogenetics. This is another department. We have multiple departments like genomics, cytogenetics, biochemistry, CMA, CES, which I'm pretty sure that most of the newly joined salesmen have already understood what these tests are, but don't worry, I won't be getting into the technical details of this. Senior person from each of these departments will be taking care of this. They'll give you a brief information in layman terms so that you can understand this, because without knowing what as a genetic lab we offer as a test, what are the pros and cons, limitations, advantages, you cannot approach a doctor, because doctors have a lot of informations. They are continuously approached by other salespeople from different genome-based companies. So who will be our competitors? How are we better when it comes to the different labs? We'll be giving you all this information in the coming few sessions, in the next few sessions that we'll be having in the next 9 or 10 days. So, okay, these are the gist of all the tests that we provide: PGX, pharmacogenomics, Sanger sequencing, and everything. So, as a sales team, make sure that you take consent of a person or the patient who has given the sample, clinical details as much as possible, because this is something we always struggle with. Everybody knows that taking clinical details or diagnosis is important. Sometimes doctors will just give you clinical diagnosis and clinicals, some of the clinical symptoms, and then they expect us to do everything. No, as a genetic lab, we make sure that whatever reports that we are giving should be authentic, should be right. It's just that just because we are getting samples from the doctors, why should we pester them with all these questions? Whatever sample we are getting, we should continue with that. Sorry, maybe other labs do that. We don't do that. If we get proper clinical diagnosis, proper clinical symptoms, all the clinical details, fine. it becomes easy for us to do not only do the analysis but for a better correlation, because obviously without all this information, if we give genetic information or genetic report or any other report, even doctors don't know what to do with that, and that's what happens. And then that's when they start they get annoyed, they start yelling, and they start comparing us with other labs, because other labs, without taking all the details, they'll just take the samples, because the only thing they want is samples. This is something which even we want, but not at the cost of patients' money or their health. If we have to do it, we'll follow a proper protocol. We take clinical diagnosis, clinical symptoms. If the patient has been referred to us, we make sure that we do it as a genetic counselor. We take family history, and all this information, as I told you, will be shared with all the lab members. All those lab members who will be getting this patient sample for the respective tests. Okay. So again, another important aspect, target audience. Now, even though I've mentioned only selected doctors, but that doesn't mean that we get patients or samples of these patients from only the selected doctors that I've mentioned, or the doctors that you can see on your screen. If the patient is having a genetic condition or a genetic disorder, the sample or the patient can come from any medical field. I mean, like from any of the doctors. It can be from any of the diagnostics, from obstetrician, ophthalmologist, eye-related doctors, child specialist, neurologist, cardiologist, and so on. So all these patients will come from all these departments for testing, which will be followed up by counseling, and when the report comes again, it will be followed up by post-test counseling. So all the tests, whenever you mention that this is something which we provide, make sure you also convey this information that along with genetic testing, we also provide free genetic counseling. I know I have already mentioned that, but this is something which most of the people tend to forget, because when they crack a new counter or when they meet a new doctor, they're so busy explaining about the genetic test, they totally forget about the genetic counseling. This is something which is very much important, and doctors are not aware of that. The moment doctors know that the genetic counseling is not only important, this is something which we provide as a genetic lab. We provide free of cost. We don't charge them. If the patient sample is sent to our lab, we do pre-test, post-test counseling. Doctors are very much interested in sending their patients. So you can talk to the doctors, ask their permission, and if the doctor doesn't have any issues, he or she will be more than happy to refer the patients to us for counseling. Okay, so these are the main aspects. Now, with the help of this case scenario, how it works, even though I have generally shown you in one of my previous slides that what is the workflow. So what happens is, when like this, I've created a scenario here where a 2-year-old male, a boy, who is born out of consanguineous marriage. I mean, like his parents are married in relation. He was presented with developmental delay. So developmental delay is something where the child is born, and at a particular age, he or she needs to start talking, needs to start walking. There should be a proper speech at this particular age. But because there has been delay in this, we call it as a developmental delay. And he or she had seizures. In this case, a boy had a seizures. Now, obviously, they'll approach a pediatrician or a pediatric neurologist who will suspect the child with some condition. I have not mentioned any condition. Just wanted to make it, put it in a simple way, rather than mentioning this condition and confusing even more. So what the condition is, what the doctor is suspecting is, based on that, he or she will suggest the parents to go for a subsequent test, that this is what I'm suspecting, and you should go for this particular genetic test. And then they will approach you, you will take the blood sample, and also doctor will refer the patient, or maybe you can tell the patient after taking the doctor's permission that we provide genetic counseling service, and you can get all this information related to the test. And that's when the patient comes to us. We do the pre-test counseling, as I told you, where we'll give all the information, relevant information regarding the condition, their family, regarding the test that we have prescribed. As a lab, what all we do, we'll give you this information in layman terms. And then post genetic testing, when the results arrive, we share a copy of these results with the doctor. And if the doctor wants, then only we share it with the patients. Otherwise, if the doctor is the one who has sent us the sample, we usually make sure that the report is shared only with the doctor. And if the doctor mentions, then obviously with the patient. And then with doctor's permission, if the doctor says that, okay, maybe I've already spoken to the patient, it would be much better if the report is explained properly to the patient, and regarding the treatment and management that I've already written in my notes. So we get those notes with the help of sales team. We explain that what the doctor has written, what doctor is seen in the report as a lab, what we have released, what does it mean. We explain them everything, and this everything again, as I mentioned, comes under post-test counseling. A clinician decides on the treatment management and everything, and then in post-test counseling we explain about the treatment, risk of recurrence. If the patient has any other further queries that I already have a child who doesn't have any issues, but whether he or she will get it, we also clear that based on this information. If the doctor suggests that okay, this is not the only test, even though it has come positive, but I think you may have to go for further testing, targeted testing. If anybody else in the family, like your brother, your sister, your uncle, your aunt, even they might be at risk, you need to go for that testing. Then now the patient who has come as a separate nuclear family now suddenly is told that okay, even your extended family members are at risk, you need to talk to them, call them for a testing. Then in that situation, why this has happened, why they have been referred for further testing, they are not clear about it. So that's when we come into picture and we tell them that this is the reason. So even though you have as a family come to us, but as a lab, as a genetic counselor, it's not our duty only to do testing for you or counseling for you, but also your extended family members who might be at risk of this genetic condition. So we don't, as a genetic lab, as genetic counselors, we not only focus on the family that has come to us, we also make sure that that family's extended family members, or that the person or the patient that has come to us, his or her extended family members also are tested, properly counseled, so that God forbid if they are at risk of this, they are made aware of this, so that they can be put under surveillance properly. Doctors are given proper information about this, and this is how, in the subsequent sessions we are in touch with the patient as well as with the doctor, so that even doctor is in this field for the patient, we as a genetic lab are in this for the patient. So we work together so that the patient benefits. We are all in this so that the patient benefits, makes most out of it, of all the tests, avail all the tests and facilities. Even the doctors should, as a lab, what all tests we do and what all tests they can refer the patient to. And at the end, the patient is who should benefit from all this. So as a sales team, if you have any problem getting the sample collection, how to pick up, arrangement of the phlebotomist, collection kit, cost of the test, payment related, these are the email IDs. You can contact our front desk or Cedric, who is the head. You can contact them. You can collect these numbers from your sales side. And if doctors want to discuss about the reports, or if doctor wants to know that if your lab is doing this test, they want to know more about the test, they want to discuss someone, a technical person from our lab, with whom they can discuss about the condition that they're suspecting the patient with, any technical issues, any genetic related, counseling related, report related, they can contact me. This is my number, my email ID. And also Ayushi, who's also a colleague of mine, she's also a genetic counselor. This is her email ID. You can take down all these details. And in case the doctor wants to talk to a senior person, head of the department, or a senior person from a respective department, like from biochemistry, from bioinformatics team, you can contact us, and we'll make sure that everything goes smoothly. And then the patient shouldn't suffer, or even the doctors who have referred the patient, they shouldn't suffer. So we make sure that everything goes smoothly, and we'll yeah, that's it. Uh, Even though I've mentioned only my name and Ayushi's, but in case any, not only related to genetic testing or counseling, but if doctor wants to discuss about report, about cytogenetics, or about biochemical genetics or anything, they can contact us and we'll try to sort it out. And in case, God forbid, if we think that we need help from an expert, then obviously we'll approach that person, and then we'll arrange for a meeting or a discussion between the doctor and that respective person. So that was it. That was a brief overview. With this session, with this presentation, I wanted to give you a brief information and overview about what is going to come up in the next few days, what all tests as a genetic lab we provide, what all facilities that a patient or a doctor can avail. And yeah, that's it, I think. Thank you. I'm open to queries Q&A session. If you have any doubts, please ask.